CNA Priority Questions Explained. Welcome to the quiz. Question 1. You are assisting Mrs. Betty Thompson, a 70-year-old female patient who has gastroesophageal reflux disease, GERD, with positioning and comfort measures. She frequently experiences heartburn and acid reflux, particularly when lying flat in bed. She is uncomfortable and asking for your help in finding a position that will be more comfortable for her symptoms. Based on your understanding of positioning for patients with GERD and gastric reflux issues, which position would be most comfortable and therapeutic for this patient? Option A. Lying flat on her back in bed would be the most comfortable, as this allows the esophagus to relax and the stomach to empty more easily. Option B. The semi-Fowler's position, head elevated 30 to 45 degrees, or high Fowler's position, head elevated 45 to 90 degrees, with support provided by pillows would be most comfortable, as elevation helps prevent reflux. Option C. The prone position, lying face down, would be most therapeutic for her reflux symptoms, as this position helps with digestion. Option D. The Trendelenburg position, head lower than feet, would help with her heartburn, as this position aids with stomach emptying. The answer is B. Elevating the head of the bed uses gravity to prevent stomach acid from flowing back into the esophagus. Option B is correct. Option A is wrong. Lying flat worsens reflux. Option C is wrong. Prone does not help and may be uncomfortable. Option D is wrong. Trendelenburg, head down, actually promotes reflux. Question 2. You're providing care to Mr. Arnold Davis, a 62-year-old patient who has just finished eating his dinner. He is lying in bed and appears to be resting. He asks if he can lie down flat in his bed soon after finishing his meal. You know that positioning after meals is important for preventing certain complications in patients with swallowing difficulties or reflux. Based on guidelines for patient positioning after meals and preventing aspiration and reflux complications, how long should a patient remain upright in a chair or elevated in bed after eating before lying down? Option A. A patient can lie down immediately after finishing eating with no waiting period necessary. Option B. A patient should remain upright for approximately 15 minutes before being allowed to lie down. Option C. A patient should remain upright for approximately 30 minutes after eating before being allowed to lie flat in bed, as this helps prevent aspiration and reflux. Option D. A patient should remain upright for 1 hour after eating before being allowed to lie down. The answer is C. Standard recommendation is to keep the patient upright for 30 minutes after meals to reduce aspiration and reflux risk. Option C is correct. Option A is unsafe. Option B, 15 minutes, is too short. Option D, 1 hour, is longer than necessary and may not be practical. Question 3. You are assisting with documentation of patient care and learning about proper charting procedures. Your nurse supervisor is emphasizing the importance of thorough and complete documentation of all care activities that you perform. She is asking you what information about patient care should be documented. Based on standards for documentation of patient care activities and the importance of thorough medical records, what information must be documented about patient care provided by a certified nursing assistant? Option A. Only procedures or activities that did not go according to plan or that went wrong should be documented. Option B. All care activities provided, the time they were performed, any observations made, and any changes or concerns noted during the care should be documented completely and accurately. Option C. The nurse will document everything automatically, so CNAs do not need to document anything themselves. Option D. You should only document care if the patient specifically requests that you write something in the chart. The answer is B. CNAs must document all care given, observations, and any issues. Option B is correct. Option A is wrong. Both routine and exceptional care should be documented. Option C is wrong. Nurses do not document CNA tasks. Option D is wrong. Documentation is a professional responsibility, not patient-driven. Question 4. You're assisting Mr. Henry Thompson, a 70-year-old patient, with passive range of motion exercises for his upper extremities. The patient has limited mobility due to recent surgery and is unable to perform active exercises independently. You are gently moving his arms and shoulders through their normal range of motion. As you move his right shoulder, he begins to wince and reports pain, and as you continue to move the joint, his facial expression indicates increasing discomfort. You need to determine the appropriate endpoint for range of motion exercises. Based on proper technique for range of motion exercises and the importance of preventing further injury, when performing range of motion exercises on a patient, you should move the joint until Option A. The patient experiences sharp pain or significant discomfort, at which point you continue moving slightly further to help stretch the muscles and increase range. Option B. The patient feels gentle resistance or mild discomfort without sharp pain, at which point you should stop and move the joint in the opposite direction. Option C. The patient's muscle begins to quiver visibly, indicating that the muscle is being adequately stretched. Option D. You have completed exactly 100 repetitions of the movement regardless of how the patient is feeling. The answer is B. ROM exercises should be performed to the point of gentle resistance, not pain. Option B is correct. Option A is wrong. Sharp pain indicates injury. Never force beyond that. Option C is wrong. Muscle quivering may indicate fatigue or injury. Option D is wrong. Repetition should be appropriate, not arbitrary. Patient response guides the exercise. Question 5. You're attending a mandatory safety training session in which your facility is reviewing emergency procedures. The instructor is teaching staff about what to do in case of a fire in the hospital. The facility uses the RACE acronym to guide staff actions during a fire emergency. The instructor is asking staff members to identify what each letter in the RACE acronym stands for. Based on standard fire safety procedures in healthcare facilities, what does the acronym RACE stand for in the context of fire emergency response? Option A. RACE stands for Recover, Assess, Check, Evacuate. Option B. RACE stands for Rescue Patients from Immediate Danger, Sound the Alarm to Alert Staff, Confine the Fire by Closing Doors and Windows, and Evacuate Patients and Staff as Directed. Option C. RACE stands for Response, Alert, Care, Emergency. Option D. RACE stands for Rapid, Assist, Clarify, Exit. The answer is B. RACE is a standard fire response mnemonic: rescue, alarm, confine, evacuate. Option B is correct. The other options are incorrect acronyms. Question 6. You're attending an in-service training session on body mechanics and safe patient handling. The instructor is demonstrating proper lifting and movement techniques to prevent back injuries and strain injuries among nursing staff. She is asking staff to identify the essential principles of proper body mechanics when lifting patients or moving heavy objects. Based on principles of proper body mechanics and ergonomics, which statement best describes proper body mechanics when lifting a patient? Option A. You should bend at the waist and use primarily your back muscles to lift, as this distributes the weight across your entire back. Option B. You should keep your feet close together, twist your torso to rotate your body, and lift with your arms extended away from your body. Option C. You should keep your back straight, bend at the knees, keep the load close to your body to reduce strain on your back, and use your leg muscles to generate the lifting force. Option D. You should lift with your arms while standing on one leg and trying to balance, as this strengthens your core muscles. The answer is C. Proper body mechanics involve using leg muscles, keeping back straight, and load close to body. Option C is correct. Options A, B, and D describe unsafe techniques that increase risk of injury. Great job! Don't forget to subscribe. Bye.